now. All right, so this week is Women's Health Week. So we are coming at you with all things women's health and what you need to do as a woman, what you should be aware of to keep yourself healthy across the lifespan. So this week I will be interviewing Dr. Hout, and she will be talking us through some of the most common things that she sees in women's health. We'll be discussing screening recommendations, and then talking very briefly about things that we do naturopathically to address women's health. Yep. So, Dr. Hout, go ahead and walk us through what the most common screening recommendations women should be aware of.
Yes. Okay, so we're going to talk about three things. We're going to talk about cervical health, breast health, and bone health. Those are the three really important things. So we're going to start first with cervical health. There are slightly different theologies on this, but I took my information from the American Cancer Society for this talk because it was just the easiest to follow. So the following recommendations are for those people who haven't been diagnosed with cervical cancer. So people who have been have different recommendations for screening. Okay, so all women have to get PAPs starting at age 21, according to the American Cancer Society. For women between the age of 21 and 29, they have to get PAPs every 3 years, but they don't necessarily need HPV testing unless they have an abnormal pap smear, right? And then from the age of 30 to 65, you can get a pap smear and HPV testing, which is called co-testing, every 5 years. If that testing is normal, or you can just get a pap every 3 years, and then if there's an abnormal, you can get the subsequent testing. So the reason why we say those women between age 21 and 29 don't need to get HPV testing is because it's thought that they're young enough and their immune system is robust enough to get rid of the infection before we even need to treat it. So that's the theory there.
Which may or may not be true, but
may or may not be true,
that is
but that's
the theory behind it.
Yeah. Right.
Yeah.
So that's why there's a discrepancy there. Now, women over age 65 who've had normal tests in the past 10 years don't need to be tested according to the ACS. And I think that's assumed because it doesn't matter if they get the cancer, that they're not going to live as long. But again, that is their theory, and I don't necessarily know if I believe that. So
I think that's a really interesting thing to discuss, because it's like 65 is pretty young now. Because with people living into their 80s and 90s, that's still another 20 or 30 years that you've got. Right. So, and to me, it makes sense to still be screening for those types of things. But again, these are the American Cancer Society guidelines, right? So it does come down to physician discretion too with some of these things.
Always, yeah, and that's something that they have in their guidelines too, is that every patient is unique and a butterfly and all that. So
absolutely. And then it's really interesting too that PAPs don't start until age 21. They used to start a lot younger.
Right.
Having them start at age 21 is actually a fairly recent change. So I've actually encountered some clients or patients who didn't realize that and had like children, and they're very concerned, like why isn't my child getting pap smears? Why is my doctor doing that? And that is because of the fact that the American Cancer Society recently changed those guidelines. So just something to be aware of.
Yep.
Okay.
Good one. Anything else on that you want to add?
No. Health? Let's move on to breast health.
That was it.
Yeah.
So breast health. There's a lot more to say about breast health, I think, than any of the other two, because there's, again, a lot of different opinions on what should happen. Generally, mammograms are the gold standard, according to, again, the American Cancer Society. Women from the age of 40 to 44 have the opportunity to start their annual breast cancer screening with mammograms during that time. And then so they should be getting annual or biannual mammograms from the age of 45 to 54. So that's about 10 years. And then at 55 and older, they can get it every 2 years. If they want to do that, they can spread it out more. And that's because breast cancer is the most common between those kind of mid to youngish ages.
The perimenopause and then initiating of menopause. So when that's when the most hormonal fluctuation is happening. And that's why.
Yeah. So once you hit 55 and you got no hormonal fluctuations, you can kind of spread it out a little bit more. So this was interesting. Screening should continue as long as a woman is in good health and is expected to live 10 years or more or longer. So that was, anyway, that's similar to the cervical cancer, and I'm not even going to talk about that anymore. They do say that you should know the benefits and the limitations and the harms of breast cancer screening. So they admit that there are harms and limitations to this. So again, that is physician and patient discretion. And then they also say that you should know, a woman should know how her own breasts feel normally so that she can pick up any aberrations.
Mm-hmm.
They don't say that women should test or do self-breast exams every month, but they say that you should know how they feel. So to me, that means you should do a breast exam on yourself every month. Now, there is something that I wanted to discuss, the difference between mammograms and thermography.
Okay.
I just want to touch on it. Thermography, even though is touted as being not as good of a screening agent as mammography, has actually been around longer than mammography. And it's just an ultrasound. So it's a little bit safer in terms of radiation than the mammogram. And it's less invasive, and you can detect earlier changes within the breast tissue than you can with a mammogram. So just throwing that out there, that's something that's available if people are interested in that.
Now, if I'm remembering correctly, like the standard is kind of that thermography can be used as more of a screening method, but mammography is considered the gold standard for detection.
Yes.
Right?
Yes. But then if you talk to thermography specialists, they will say that thermography is a lot better at detection too. So I don't know. But the gold standard in modern medicine, yes, is mammograms. So that's that.
That's food for thought. There are other options out there.
Yeah, exactly. So
okay, so
bone health. Breast health?
No, let's talk about bone health.
Okay, bone health. So according to the National Osteoporosis Foundation, all women over the age of 65 should get a DEXA every 1 to 2 years. And that is, again, a scan that kind of looks for bone density to make sure, because after age 65, your estrogen has gone down, and estrogen protects your bones. So we want to make sure that your bones aren't going to break due to lack of estrogen. And then postmenopausal women from the age of 50 to 69 who have risk factors for osteoporosis should also get a DEXA, even if they're not above the age of 65. So if you have risk factors, you need to get a DEXA. If you're over the age of 65, you need to get a DEXA.
And what are some of those risk factors that people could have?
Yeah. So family history is a big one. Having a fracture in a big bone that shouldn't really have a fracture in it, that's called a fragility fracture after the age of 40. That's one. Steroid usage for over 3 months, which is unfortunately somewhat common. And then estrogen deficiency, which is what we talked about. Menopause is essentially estrogen deficiency.
Yeah.
And then having any abnormalities of your bone structure from birth or maybe from an accident or something like that. So those are some of the common risk factors.
Yeah, and I just want to touch, so like steroid use for people who don't know what like common steroids are. So like prednisone is a really common steroid that people are on for typically a long time.
Yeah.
It's meant to be used short term, but there are a lot of people who are on it long term.
Yep, right. That's a problem.
Yeah.
It's your bones.
So stuff. I know. A major problem. So those are the main 3 things that people need to be on the lookout for as far as women's health screening. So we got the cervical health, the breast health, and then the bone health. So let's talk really briefly about the most common women's health conditions that you see in your office.
Okay, so let's talk with about estrogen dominance. This is the opposite of what we were just talking about. This is common, unfortunately, right now because of stress, xenoestrogens in the environment, or just having a genetic propensity towards low estrogen because of something going on with the liver or just enzymes in general. Estrogen dominance literally means there's too much estrogen, not enough progesterone, or some kind of imbalance whereby you have too much estrogen, not enough progesterone. Infertility, the definition of that is not being able to conceive for 1 year.
This is actually really common now. It's becoming,
yes.
it's becoming very common. I've seen a lot of people with this lately.
Yeah, yep. And there's so many different reasons for it. So we are not even going to talk about that. Postpartum depression is something that you wanted to discuss, which is really interesting. I've never dealt with this myself personally, but this is a severe, long-lasting form of depression that begins either before, during, or after the baby's born, and it can even start up to a year after birth.
Yep.
So this is like having really severe mood swings, difficulty bonding with a baby, guilt, hopelessness, thoughts of hurting yourself, anger, such stuff like that.
Yeah, and interestingly too, this can also present as anxiety. So
Yeah.
it's not necessarily depression, it can also be anxiety. So don't think just because you're not down in the dumps doesn't mean that there's something that's very real happening there.
Right.
Depression or anxiety can occur.
Yeah, there's a wide range of symptoms for this one. Yeah. Another really common one is PCOS. Oh my gosh. So this is complicated. It's multifactorial. It's basically cysts on the ovaries, insulin resistance, and then irregular menstrual cycles, usually longer, scantier ones. Usually the hormonal stuff that's going on is there's low progesterone, high estrogen, which we just talked about, right? Estrogen dominance, and high testosterone. As well as, I already talked about insulin resistance, right? So that, okay. So that's all there I'm going to say about PCOS, again, because this is a very complicated and multifactorial condition.
We could do an entire episode on PCOS sometime.
Yeah, we could, and we should. Yeah, okay. It's very interesting. Okay, so there's that. HPV, human papillomavirus. This is an infection, or causes an infection which results in warts all over the place. Typically, we think of like the genital warts and the anal warts. Those are caused by HPV. These need to be treated because they can lead to cancer. So the growths of the tissue can ultimately lead to cancerous tissue. And this is why we get pap smears. So when we're talking about cervical cancer screening, we're talking about this,
right?
HPV.
Right.
So
this is the reason why.
Yeah, right. This little bugger. And then we have PMS and menopause. So PMS is kind of like, everyone knows what this is. Every woman understands what PMS is. It's a constellation of symptoms that affects you before or during or even after, for myself, your period. And it involves emotional, physical, behavioral symptoms such as sugar cravings, mood swings, fatigue, anger, all kinds of things. Again, very large constellation of symptoms here. And then menopause, lack of menstruation for 1 year. This usually happens around age of 50. And it's a result of basically ovarian failure because you're old and you don't need to make babies anymore, according to evolution. So every woman who's gone through menopause understands that there is night sweats, hot flashes, weight gain, fatigue, skin changes, reduced sex drive, everything. Again, wide constellation as a result of lack of hormones. So in a nutshell, those are the symptoms that are the most common female.
Yeah, and that is definitely not an exhaustive list of all the things that we see women's health related, but it is the most common thing that we see women's health related. And I just really quickly, I just want to make a point about menopause, because it's kind of this thing we've been told is just like, oh, it's normal and you just have to get through it. And that is not necessarily true. There's a lot that we can do to make it a more graceful transition.
Oh yeah, definitely.
Right?
Yes.
So yeah, don't accept that just because you're going through menopause, that means you have to be miserable. That's not true at all.
And yeah, and I have to say, menopausal women really respond very well to naturopathic treatment.
So true.
It's one of the most successful things that I address.
So that's a perfect segue into our next section, which is just real quick, some things that we do to treat women's health naturopathically. So first of all, you wanted to talk about safe sex. So
yes,
go through and just like some quick bullet points on that.
Okay, real quick. It's really important because we know that these infections can cause things like cancer and long-term disease. Just be safe. Wear protection if you are having sex with multiple partners.
And get tested.
And get tested. Yes.
Mm-hmm.
The
Mm-hmm.
end. That's all I want to say
Absolutely.
about that.
Absolutely. And then as far as some of the other things that we do, a lot of it has to do with modulating hormones. So getting them back
Yep.
into a better balance. And we can do that in a couple of different ways, either with herbs, with diets, with essential vitamins and nutrients, or we can use bioidentical hormone replacement as well. So I'm just going to talk real quickly about some of the things that we use that actually modulate hormones. So the first thing that kind of falls under the dietary realm is something called seed cycling, which a lot of people have not ever heard of before, but it is so powerful and it is so simple. And it's basically just a cycling of different seeds during different phases of the menstrual cycle. So these seeds actually contain something called lignans, which are a chemical essentially that is, it's a lot like estrogen or progesterone in the body. So, for instance, during the follicular phase, which is the first 2 weeks of your menstrual cycle, you use chia, flax, and pumpkin seeds. And then in the luteal phase, which is the last 2 weeks, you use sunflower and sesame seeds. Super easy. You can find all that stuff in the grocery store and it works like a charm.
Yep.
So the next thing that we use are herbs. And these are, we call them hormone modulating herbs, which means they either increase or decrease the hormone that we're using them for. One of the most common ones we use is called Vitex. It's really amazing and it helps us to increase progesterone in the body. So typically we'll use it during the luteal phase, which is when progesterone is supposed to be the highest.
Yep.
Essential vitamins and nutrients for the women's reproductive system are things like magnesium. I mean, magnesium is important everywhere.
Everything.
It's used in like hundreds of biochemical reactions in the body. So magnesium really matters. And then the B vitamins are huge
oh my God.
for women's reproductive health.
Yes.
Huge. And in higher doses than you will find in most multivitamins. You have to really hit the B vitamins hard.
Yes.
So bioidentical hormone replacement is something that is becoming much more common. And I just want to say, all right, this is not your grandma's hormone replacement therapy.
No.
This is completely different. It's safer. These are hormones that look physiologically more like what your body has. So it can actually be used and metabolized in a similar way as your normal hormones, which means it doesn't build up and lead to risk of cancer or other types of things that the other hormone replacements did.
Yeah.
And last but not least, we would be remiss if we didn't talk about environmental toxicity and how that affects the reproductive cycle. So things like plastics, cosmetics, and cleaners are all endocrine disruptors. And basically what that means is they have chemicals in them that look like the hormones in your body. So when you use them constantly, you're pretty much just adding extra hormones or hormones that take binding spots away from your normal hormones. And that can lead to this estrogen dominance or deficiency or any of those type of symptom pictures.
Yep.
So that was a very quick rundown of all things women's health. And I definitely think that we could expand more on these, but that's all the time that we have for today.
Yep.
So why don't you go ahead and tell everyone where they can find you, Dr. Hout?
Me, yes. I'm in New Jersey, Merchantville Medical Wellness Center. HolisticDrHout.com is where you can find me, and also Holistic Dr. Hout on social media.
Perfect. And I am Dr. Carleigh Golightly. I am in San Diego, California, and you can find me at Dr. Carleigh Golightly on Instagram or empowermedclinic.com.
Woohoo!
Thanks for joining us.
Bye.